And the summer wind is blowing and the temperatures, well, they're rising. Coming indoors from the summer heat to a refreshing blast of air from air conditioning can be a summer pleasure. But did you know the cool breeze from air conditioning may actually make our eyes feel worse if there's an underlying undiagnosed problem? Nationally renowned ophthalmologist Dr. Neda Shamie joins us this morning with information on chronic dry eyes. So welcome, Dr. Shamie. How are you?
I'm doing great.
Yeah, I personally have a problem with dry eyes. Like, what is chronic dry eye syndrome exactly?
Chronic dry eye syndrome is a condition that affects more than 25 million Americans, most of whom may not have the diagnosis on hand or may not be diagnosed yet. It's a condition that causes inflammation in the eye and lowered tear production. And this can then become a vicious cycle where the eye surface can have damage as a result of the dryness and the drying, and the inflammation can then really eat at the eye surface or the cell layers, and this can then lead to scarring and decreased vision if it's left untreated.
Yeah, that's a huge problem. Yeah, I was going to ask you like some of the symptoms, because I know sometimes I'll get like red eye and it almost looks like you have pink eye, but you don't. There's a prescription that I take for that. But what are some of the red flags that we need to look for when we're talking about CDE, chronic dry eye syndrome?
Probably the most common red flag is reliance on artificial tears. So if you find that you have to stash artificial tears in your purse, at your desk, at your bedside table, that in itself is a telltale sign that you're suffering from a chronic condition that's probably getting worse because your reliance has increased. There's other symptoms that I have seen in my clinic when in my practice when patients present with chronic dry eyes. Redness, as you mentioned, kind of a sandy, irritable surface of the eye when you blink, irritation on blinking, blurring of the vision, especially when you're working on the computer. If you find that you have to force yourself to blink to produce more tears, these are some of the symptoms associated with chronic dry eyes.
Yeah, and that causes a huge problem, especially in our industry when we're constantly looking at computers. But what causes CDE to begin with?
It's hard to know. I mean, we don't really fully understand what leads to chronic dry eye disease, whether the inflammation is what leads to lower tear production or the lower tear production leads to the inflammation. Regardless of what the cause is, what we do understand is that inflammation is at the core of this problem. And the treatment for it, when you have chronic dry eye disease, is not to cover it up with artificial tears. It is to get to the core of the problem. And there are prescription eye drops such as Restasis, which can be prescribed by your eye doctor when this diagnosis is made. It's used only twice a day. And Restasis can lower the inflammation and can actually help your own eyes produce more of its own healthy natural tears. Restasis can start having an effect as early as 3 months after treatment, and as long as the individual is on Restasis, as long as you're on Restasis, you can expect your tear production to increase.
Okay, and so that's the recommendation for treating CDE is Restasis. And how do we get that?
There are multiple treatment options. Restasis is one of them, and it is one of the first ones that you'd want to try if you have signs of inflammation. It's a prescription eye drop, so your eye doctor can make that determination whether or not you would benefit from Restasis, and they can then prescribe the eye drop for you.
Gotcha. Okay. And any further tips on how to prevent CDE?
I think you mentioned, again, in summertime, especially, there are environmental conditions that can exacerbate the chronic dry eye disease. Air conditioning is a real problem, use of the fan, so if you can minimize that as much as possible. If you're sitting in the car, try not to have the air conditioning hit your face, directed towards your feet. It'll still cool the air in the car. Same with fans. Ceiling mounted fans are, especially when you're sleeping, not a great idea, especially if you have dry eyes. I think using a humidifier, if you're working at the computer, it'll at least help humidify or moisten the air around you. If you're working a lot on the computer, try to force yourself to blink as much as possible and avoid the stare that comes with staring at a computer screen. Try to take breaks every hour, walk away, hydrate yourself as much as possible, and also using an anti-glare screen cover would be very helpful. Also lowering the computer screen below your eye level so that when you're working on the computer, your eyelid is only partially opened, and therefore the drying effect will be lessened.
All right, Dr. Shamie, thank you so much. CDE, of course, a problem for many, unfortunately, and Restasis looks to be an answer. All right, well, thank you so much for joining us. Stay with us. More with Let's Talk Live coming up after the break.